We got a question in from Pat in Boston. She emailed us at questions@askjoedimatteo.com, where you can email questions too. She said, I have listened to your program for many years and use your products. I miss your dad. I assume she's talking about your dad's program because this program hasn't existed for many years. I'd like to come off cholesterol medication. What can I use in its place? Thank you, from Pat.
Yeah, I mean, we get a lot of questions like that. That's sounds very specific, but it's very broad.
Yeah.
And what I mean by broad is if you have history of heart attacks, and in your family, you've had one, you're on 40, 80 milligrams of Lipitor, well, then the plan for you to come off of your cholesterol drugs is for all intents and purposes, not to. Okay. And that would just be, that's kind of one extreme.
Yeah.
But it's out there and it's not uncommon. And then the other extreme is, maybe you're in your 30s or 40s or maybe even a little older, but you eat a great diet. You feel like you're very healthy. Your number just crept up above what your doctor maybe felt was comfortable. And he put you on a low dose, put you on 5-10 milligrams of simvastatin, and you feel like you're this close. And maybe if you were doing some other things, maybe picked up the diet a little more, started eating a little better, exercise a little more, and you added a supplement that at that point, with being open and honest with your practitioner, that at that point you could come off. So it just depends, Pat, where you are in that scale. If you're on that first scale I mentioned, you just kind of got to do what you got to do. Improve your diet and exercise more, no matter what. That's only going to help your health as time goes, and potentially you could maybe see some dose decreases if you do those things.
I was going to say, is that a possibility? Even if you
sure.
can't get off completely, can you reduce your dose potentially?
Yeah, unless you're hitting tons of markers like bypass surgery, like unless you're hitting really like certain levels of markers, they're just going to want you on like an 80 milligram dose or something, 40 milligram dose. Unless you're hitting some of those really high markers, yes, they're going to still be basing, for the most part, they're not going to want you to go too low, and we don't want to see that either. We don't want to see it driven too low. So that's always out there. Step one, if you feel like you're in that mid to high range and you can't come off right away or anything like that, that maybe first goal is, again, because it's going to be so good for your health overall anyway, to maybe have dose decrease be goal. So if you're in that lower range, you just started, you're on the low pill, you don't have a whole lot of history, then yeah, we could look at something like red yeast rice.
Yep.
2 of those twice a day. You could also look at something like bergamot. You can take them together, or you can start with one or the other. So those are 2 great options, 2 great supplements that we would recommend, that we've been using for years. That, again, if you fall within the proper parameters, and you're upfront with your doctor about how you're going to go about doing it, even better if you want to work with us, where we have a nurse practitioner that can at least work with you, and at least whenever you talk to your doctor, help you make a little bit better of a decision and help you maybe to convey what you're doing better. I think that's an ideal way to do it if it's something you really want to do.
Makes sense.
There's definitely some parts that we need to add there. When initiated on cholesterol medication or statins, it's not just based on the number.
Yeah.
Your cholesterol value, that's certainly a massive component of it. It's initiated based upon your ASCVD risk. So at some point your doctor may have discussed, it stands for atherosclerotic cardiovascular disease. So if your risk is greater than 10%, they're going to recommend some sort of cholesterol lowering agent. And beyond just the cholesterol lowering benefit of the drug, there are some other purported benefits as far as reducing the risk for a cardiac event. So it's tough.
Yeah.
It's tough. I would be curious to know what her risk is.
Right. There's any details in there.
Yeah.
So we don't know age, we don't know weight, we don't know lifestyle.
Yeah. And so it is tough. I mean, they're seeing more and more, the lower you get the HDL, the better it is. And so you kind of understand why they're quick to initiate. And the other layer to this is, something I think we should talk about soon is, there were updates in the European guidelines with how a lot of this works.
Okay.
And there are some new blood markers that they're testing for.
Oh.
And so I don't want to speak out of turn as far as what those exactly are. But again, if you are somebody, in this case, theoretically, maybe Pat's on the fence, maybe her risk is around 10, maybe it's a little lower, her doctor just wants to be safe, maybe she wants to try red yeast rice, whatever. There are some other labs that can be done to further, classify what is the specific particle. What's the particle sizes? What kind of cholesterol particles are we dealing with?
Right.
There are certain particles that portend these sort of long-term event risk issues.
Yeah, because not all cholesterol is the same.
Right. And beyond just the HDL, LDL thing. I mean, it's all within sort of the LDL umbrella that there's something specific about those particles that these guidelines talk about, and I think that we'll talk about at some point.
Yeah.
That if this is something she wants to explore a little further, we can talk to her. We can have her ask her prescriber about some additional testing.
Okay, so bottom line is she needs to make sure she's communicating with her doctor openly and honestly. She needs to make sure that she's doing the lifestyle things, eating a proper diet, and exercising. I know weight training is big, right, for lowering cholesterol. Resistance training, I guess that's the technical term. And we need to, she can look into red yeast rice and bergamot to kind of help bring those numbers down altogether. But the bottom line is, if your risk is too high, you may just need to stay on them forever. And that's okay, because that's better than dying. And definitely talk to your doctor. And if you want, we can work with them, talk to Joyce, and get some specifics figured out there. Very cool.